This is section 5, medical evidence and my story and more in depth. To simplify things, I think it's best to present my timeline filled in with my evidence in chronological order, starting with the text messages when I started the job. I was offered the job as a Freon disposal technician on September 24th, 2017. Hi David, do you have any interest in being trained in the warehouse? We want to have a backup plan and may also be an option for you if they decide to go to contracted trucks only. Alright, I can't prove when I started having an increase in palpitations, which was really the main symptom I was experiencing, probably around month 2 or 3. I remember telling my supervisor that I'd found some documentation that said Freon can cause irregular heartbeat and suggested people with heart problems shouldn't be working with Freon. I was told this was not possible. I stupidly ignored the palpitations, thinking that as long as I got out before having a heart attack, it would be okay. It just started out as a few extra ones here and there, and eventually I started having dozens a day. At one point I realized I couldn't keep doing the job, and I knew eventually I was going to have to quit. Here's some text messages between me and a coworker. Here I am talking about October 21st, they removed the rollers and line. Now I have to crawl around on my knees all day to drain and strip these things. And then in January, they had me start taking the compressors off as well, so that increased the time I was on the floor next to these systems while they were losing the rest of the gas. There was a day that the vice president shut the cracked bay door right in front of my supervisor, and I called off the next day and was asked to take a WMIS course, even though the documentation that they had did not mention anything about cardiac sensitization. Apparently that was January 16th. Dave, if I forward you a link, are you able to do the WMIS course at home? I called in maybe a week or two later when the roads were packed in snow, and I think it's obvious I was starting to deal with some kind of mental fog because I was starting to become a little aggressive. On January 23rd, I said, you can come pick me up now if you need me there that badly, but I'm not risking my neck and insurance premiums to drive to a job where I'm treated like I'm nothing. And this happened a week after the bay door was shut on me. And this was done right in front of my supervisor, and I've already told them several times about the palpitations and the documentation I had found, but they didn't listen. They just kept telling me that it wasn't possible. Towards month 4 or 5, I started to experience a mental fog, but I wasn't really aware of it. I just knew as the week dragged on, I would feel worse and more combative with people. Over the weekend, I would get some respite, but it was only temporary, with the cycle repeating on a weekly basis. By the end, I was already experiencing heart flutters, heart thumping, and my heart racing, things I've never experienced before, and that scared me. I do not have the money to pay for the medical records from the walk-in when I first attempted to get help, and I already know what they say for the most part. I was told by WCB that these files were not relevant to my case, so I do not have any idea what my blood pressure was during this time. I first attempted to seek help on February 22nd. Not having a family doctor, I went to a walk-in. On February 22nd, I sent a message to my coworker saying heading to the ER soon, probably done with my company. I'm having crazy heart flutters. There's a stupid leak in the machine. I'm fine. I need to get checked out anyway. I just can't be working around Freon because of the heart thing. I imagine I'll get unemployment. I sent a text to my supervisor that same day saying I just got out of the walk-in. The doctor reamed me for not coming in sooner, mainly because of the family history. He wants me to do an x-ray and blood work ASAP. So I figure I'll come in and load Buddy up and leave at 8 to go to the hospital. I can't remember exactly how many times that I went to try and get help. I know the next time I went back for my blood test results, I was told that I wasn't allowed to see the first doctor who prescribed me a blood pressure medication called Via. I was told over and over by every person that I seen that Freon cannot cause a regular heartbeat and that I did not have it. I sent a message to my supervisor. I literally feel like I'm going to have a heart attack. Regardless what happens today, I'm not going back to work until I'm cleared or the leak in the machine gets fixed. I am exercising my right to refuse work. My supervisor says, keep me posted what the doctor says. And I say, I'm not leaving until I get hooked up to an EKG. I've had heart palpitations since I was 16. This is something worse. The very last time I attempted to get help before deciding that I had to quit my job would have been on February 26th. I went to the walk-in because the anxiety and adrenaline had triggered some kind of regular heartbeat, and I guess I did feel like I was going to have a heart attack. When I went to the walk-in, I remember being laughed at for the Lyme disease test, and when I asked for an EKG, I was ridiculed for thinking they might have one there. When I left, I was extremely upset, and the doctor was yelling my name behind me as I walked away. I called my wife and told her to meet me at home and to come to the ER with me, and on the way home she had an accident. I don't know exactly what happened after that. Everything started to go into tunnel vision. I started to experience chest pain. I remember getting out of the car and crawling up the stairs and collapsing on the deck. When I came to, I called 911 thinking I had a heart attack. Here's the rest of the messages between me and my supervisor. February 26th, payroll emailed my supervisor and said that I didn't have enough sick days for one day, but I had enough vacation time to use for one day. So do I want to use that? I said, yeah, that's fine. And then they told me we're not going to be able to give you a layoff. Unfortunately, if we lay you off, we wouldn't be able to hire someone else for the same position. The president of the entire company again confirmed there's no leak in the machine as he tested everything, and they are sending a new gasket for the filter. Let me know your thoughts on what you decide. I can train a new person, so there's no need for you to be responsible for that. What is a leak but Freon coming out of the machine? If the Freon's coming out of the machine because of a bad filter, that's still a leak. It doesn't matter if it's the filter or not. And even then, it was always leaking from the very beginning, from day one, and I told them that. I told them I'm going to miss the job, I really am, but the heart thumping scared the crap out of me. After researching and seeing the link between family arrhythmia and Freon, knowing that my dad, who died from congestive heart failure, my sister who is on beta blockers, and my brother who was recently diagnosed with cardiomyopathy, were all diagnosed with arrhythmias, and I can provide documentation of that. I would have to be stupid or suicidal to risk a heart attack or death. So sorry, I can't come back. I planned on going to the temp agency next door and looking for work tomorrow or Monday. I can bring you the key and the jacket and sign anything then. Dave, I completely understand. I will find out if you need to sign anything and let you know. I even tried to reach out to WCB a few times. I can't even remember how many times. I just remember the last time I reached out to them that they told me not to tell my employer about my health issues, and that if I was still having problems that I should file a report with WCB because there's nothing they could do without a report. By the time I met Dr. D, my wife's family doctor, on February 27th, I had already given up hope on anyone believing me. My wife was there, and I told him the same thing I told everyone else, that I was poisoned refrigerant, and when he told me that wasn't possible, I didn't fight him on it. I just focused on the family condition, which I thought was my best bet for getting help at the time. He seemed more concerned if me and my wife were using protection while having intercourse than what had happened to me. I foolishly believed that if I just did what he said, that he would eventually see I was telling the truth. He gave me my blood test results, which he said were completely normal except for some elevated cholesterol. And he claims my blood pressure was 130 over a 90 that day. My blood tests, for the most part, were completely average. I do worry about what a blood test would say now, though, after 7 months of high blood pressure and years of suffering from chronic ear infections. Besides the cholesterol, there were elevated ALT levels and another marker that can indicate liver problems. I believe that is due to the recurring ear infections, but I'm not a doctor, I don't know. First off, I'll show my blood test results. The ALT, this is a marker for liver function. It's kind of high. Nobody bothered to tell me anything. I don't drink alcohol either, so it's not because I drink alcohol. My triglycerides were great. The cholesterol was it was moderate. My HDL, the good cholesterol, was good. The LDL cholesterol, the bad cholesterol, was bad. The cholesterol HDL ratio was okay, and the non-HDL cholesterol ratio was not that great. But nothing, I was never even asked to take medication or anything. And for someone of my weight, I think these results could be much worse. The other marker for the liver is this urobilinogen, which I'm not a doctor, I don't know. Had a Lyme disease test done, it was negative. My chest ray x-ray was negative. I felt it was important to get a Lyme disease test because where I'm from, several people on my street ended up with Lyme disease right around the time I left. And I was also bit several hundred times the last time I was there. So I just wanted to rule out Lyme disease. I was finally allowed to see a cardiologist on May 5th. 2018. Dear D, many thanks for asking me to see this pleasant gentleman, 34 years of age, who has been complaining of intermittent palpitations for the last number of years, which isn't true. I was complaining about it since I worked with the job. He thinks they have improved since he had left his previous job, which involved using Freon. He describes the fluttering in his chest. This is usually preceded by a pause, like his heart is stopped for a second, and then a strong beat. The fluttering is associated with some feeling of head rush. He's never had any syncope or pre-syncope, although a couple of months ago he was agitated with life in general and he developed severe crushing upper thoracic discomfort lasting about 5 minutes. He did call the emergency services, who came over and did an EKG, and he told me he was having a panic attack. He denies any exertional chest discomfort or shortness of breath, no PND orthopnea, no ankle edema, no syncope or pre-syncope. There's a family history of cardiomyopathy of some type. His brother has it, his father had it, and his grandfather had it. He smokes marijuana, no cigarettes, doesn't drink any alcohol. He does have a history of hypertension and was on blood pressure pills but ran out of them and has not been taking them. The rest of the systematic inquiry is unhelpful. Clinically, his blood pressure initially was very high, 200 over 110, although it did come down to 170 over 110 by the end of the exam. There was no evidence of peripheral vascular disease, no radiofemoral delay, no brutes, heart sounds are normal. There's no S3, S4, no murmurs. Chest was clear, abdomen was soft, his thyroid felt normal. There was no lymphadenopenia, no jaundice or anemia clubbing. His abdomen was obese. His resting ECG was normal. His echocardiogram was normal as well, with no evidence of any cardiac myopathy, normal ejection fraction, normal valvular structures. In summary, his symptoms are compatible with isolated PVCs. I've reassured him he does not require a Holter to document these. However, they may be aggravated by his hypertension. He definitely needs to be put back on an antihypertensive medication. I would try something like Tiazac, which may help his palpitations, or even a beta blocker, although he's already complaining of fatigue, so would hesitate in using a beta blocker as a first-line agent. At this point, I'm still trying to convince myself that I would get okay I'd be okay on my own. That's why, he thinks that they have improved since his last job. I never said that I was having problems for the last couple of years. I said I've only been having problems since I worked with Freon. This part where he says he was agitated with life in general and developed severe crushing upper thoracic discomfort lasting about 5 minutes, that was me when I talked about passing out on the deck after getting into it with the doctor and my wife having her accident. I never told him I was agitated with life. And this part where he says was on blood pressure pills but ran out of them and has not been taking them, that never happened either. I never ran out of blood pressure medication. I told anything I was taking the blood pressure medication, it was making things worse. I can't believe that 200 over 110, even if it come down to 170 over 110, is considered acceptable blood pressure. And at the very end, he even says he definitely needs to be put back on antihypertensive medications. I would try something like Tiazac, which is diltiazem, which is a calcium blocker, right? I should have been given a calcium blocker first and then a beta blocker, but I was asking for a beta blocker because that's what my siblings are on. My next visit with the doctor, I think, was on May 8th to review this note. My blood pressure was 160 over 90. On June 19th, it was 145 over 100. The problems did not continue to get better despite finding a better job and taking my blood pressure medication. Up to this point, I was still living in denial that it would get better on my own. When the problem started to manifest itself during the night shift at that brand new perfect job, I attempted to pressure my doctor for help again. On June 19th, he doubled my blood pressure medication to the maximum dose. Even though I told him I was taking it, it was doing nothing to help me. I asked him for sleeping medication, which I thought would help me with sleeping during the day for the night shifts, and that would help get rid of the irregular heartbeat. But he told me he would not give me, sleeping medication to someone who was so young. I then asked for a sleep apnea test, thinking that maybe the sleep machine would take just enough pressure off my heart that I would be okay. And I was also given another referral to the cardiologist. After a few days after starting the extra blood pressure medication after doubling the dose, I got into an argument with my foreman in the middle of the night about wearing a respirator while working with solvents. I didn't want to wear one because it made my regular heartbeat worse at night, and he demanded I be moved to another crew because of that. I was switched to another rotation. I have a company email here. Hi David, I know when we chatted about the weekend on Sunday afternoon, we had mentioned having a discussion on Wednesday evening at shift change. Would it be possible to expedite that discussion today? And this discussion would have been over the shift change, going to a different shift. After I still had performance issues, I pushed myself too hard in the heat one night and gave myself heat exhaustion. I was let go. Finally, I don't blame him for letting me go. I still feel really bad about all that. Here's an email from August 7th about the incident. I appreciate the account you've provided below and certainly can empathize with how uncomfortable the heat has been lately. The purpose of the physician's documentation that you provided last week was to ascertain whether you have had any physical limitations that prevent you from performing your regular duties. As everyone has been made aware, there are none presenting, because my doctor said there was nothing wrong with me, right? So a few days after this, I got to see the cardiologist again. Cardiologist second visit. Many thanks for asking me to see this gentleman again regarding his palpitations. For some reason I can't find his initial consult note. However, I saw him 2 months ago. As you know, mainly at night, he has symptoms of palpitations, usually skipped following by strong thump feeling. He feels very lightheaded, pre-syncopal, but no history of syncope. Sometimes he gets some racing, but usually it's just the palpitations, i.e. the skipping followed by a strong beat. As noted, he has hypertension currently on irbesartan 300 milligrams, the maximum dose. He takes no other medication. He has no other significant medical history. He is not diabetic. He does not have dyslipidemia, no history of heart attacks or strokes, peripheral vascular disease, diabetes, etc. He smokes occasional marijuana, but no other significant use. Clinically, his blood pressure today was still elevated, 170 over 100. He was in normal sinus rhythm, and normal EKG resting clinical exam was unremarkable. No radiofemoral delay, no Brutes, precordial examination, heart sounds are normal. There's no S3, S4, no murmurs. His chest was clear, abdomen was soft. In summary, this gentleman is most likely isolated symptomatic PVCs. As you know, his echocardiogram was normal. I will arrange a 48-hour Holter for him. If there is anything concerning, I will see him again. If he does have simple PACs and PACs and PVCs as a cause of his symptoms, I would suggest you try him on a beta blocker or a calcium channel blocker such as Cardiazem, which is Dialshazem, which will also help his blood pressure. Many thanks. It was at this point I had to face the reality too, that I wasn't going to get better on my own, no matter how much I willed it or believed it or tried to make it happen. At this point I had to give up working. I only started working maybe 2 days a week, and I was sleeping about 10 to 12 hours a night, and I still couldn't get relief. I was still having 100 palpitations a day. Nothing was helping me. I was taking my blood pressure medication. I was doing everything that I could. I don't know what more I could have done. I was finally given a basic 48-hour Holter monitor on October 1st, 2018. Here are my Holter results. Admittedly, they're nothing crazy. Some doctors don't even want to treat PVCs until you're having thousands of them. But it shows I had about 100 ventricular beats, only very few supraventriculars. I did have quite a bit of tachycardia and bradycardia, 21% total heartbeats, 13%, that's 34% of my heartbeats were out of rhythm, right? Here's the interpretation right here. The very first line of the interpretation is prevailing rhythm was sinus arrhythmia. Every time I had a palpitation and I hit that button, I was experiencing some kind of cardiac event. Dizziness and palpitations was sitting at a desk, isolated SVE and sinus arrhythmia. I may not be a doctor, but I do know how to read, and I don't understand what prevailing rhythm with sinus arrhythmia means if it's normal. I know that some sinus arrhythmia is normal, but I'm fairly certain your prevailing rhythm is not supposed to be irregular. You might be able to tell me this is a normal reading for one person, but it isn't for me, and you need to give me another Holter test to compare it to a baseline. If you want to see what my heart was like before being poisoned with Freon, then just go ahead and give me another Holter now. I barely take any medicine, so if my heart's still doing the same thing as what was shown on this Holter, there, you got your proof. You guys have a legit reason to deny me, but until you give me another Holter, you really don't have anything to say there. At the end, I was seeing minnows from simple things like using the bathroom or getting up too fast out of bed. I was waking up with extreme kidney pain on a daily basis. Almost every night I would go into severe irregular rhythm where my blood pressure would spike to the highest I seen it, which was 200 over 160. My wife begged me to go to the ER on multiple occasions, and I told her, what's the point? I go, by the time someone sees me, my heart rhythm is normal again, and I'm just told to go home? Yeah, no thanks. It's a waste of my time and the system's time. One morning I was saying goodbye to my wife who was leaving for work, and I coughed just a little bit and seen an imprint of my retinal nerve on my eye. If the results hadn't shown anything, I didn't know what I was going to do. It took a while, but eventually I started to recover. I believe the beta blockers were key because they were blocking the zone of my heart which absorbs the adrenalines or the catecholamines. But again, I'm not a doctor. I just live in my body. Once the palpitations were under control, my blood pressure followed suit. On March 16, 2019, I was given an increase in dose of metoprolol when I started a new job that involved working 12-hour shifts again. I was eventually let go after probation period through no one's fault but my own. Around this time, I filed my initial and formal WCB report about what had happened, since I had now had proof of an irregular heartbeat. I also started to regain the ability to think within a few months of being properly medicated, at which point I stopped taking the blood pressure medication. I took it for 7 months. It did nothing to help me. Why would I keep taking it? Someone from WCB called me one time, asked me if I had a family doctor before all this happened, and when I said no, they expressed unbelief. I was never contacted again after this. After a few months, I assumed no one took me seriously, which is why I wasn't waiting on WCB to help me in the first place. I'm glad to know I made the right decision. Almost a year later, I get a call again from someone at WCB asking me to resubmit everything again. So I did that thinking that maybe I would be taken seriously this time. It took them 2 weeks, if I recall correctly, for them to make their decision. You were employed by your company as a central disposal technician. In WCB injury report, you indicated that while draining fridges and freezers, you were exposed to Freon 12 from a leaking reclamation machine as well from gas pooling on the floor due to inadequate ventilation. You stated that this caused you to have a heart arrhythmia. You indicated that you reported to your supervisor that you were having heart palpitations, but you were told to just get a note. You indicated that you tried going to the doctor, the emergency department, and even called an ambulance during an episode, and that you were told that without a note you would have to quit. You advised that seeing no other option, you quit your job. You left a voicemail at the WCB on indicating that you did not have a family doctor until your workplace accident. You stated that your new family doctor was Dr. D, and you added that your family doctor just told you that it was all in your head and you need to see a psychiatrist. You said that you then saw another practitioner in the clinic. A chart noted that you indicated reporting having palpitations. A referral note to the cardiologist, Dr. B. He advised that you'd had palpitations since the age of 14, which were now worse. He noted that you had a family history of palpitations. You saw the cardiologist on May 5th, and in his report to Dr. D, Dr. B noted that you'd been complaining of intermittent palpitations for a number of years. You reported thinking that they had improved since leaving your last job, which involved using Freon. Dr. B indicated that you told him that a couple months earlier you were agitated with life in general and developed a severe crushing upper thoracic discomfort lasting about 5 minutes. You reportedly called emergency services who went to your home and did an EKG and told you that you were having a panic attack. Dr. B noted that you had a family history of cardiomyopathy of some type and that your brother, father, and grandfather had it. He noted that you had high blood pressure and took medication for it, but that you had run out of medication and had not been taking it. You recommended that I resume taking my medication. On July 11th, I seen another doctor at the same clinic, Dr. S, because when I got into it with my foreman at that job there, I was pretty upset with Dr. D for just doubling my blood pressure medication, not doing anything for me. So I went and seen another doctor at the same clinic, doctor who didn't want to do anything either because I was Dr. D's patient. He didn't want to interfere with his diagnosis. He noted that you were recently found to have high blood pressure and that you were now taking medication in that regard. You denied any chest pain or palpitation and told Dr. S that you thought your symptoms may be due to anxiety. The assessment was of hypertension. You were placed off for work for 2 weeks and advised to continue with your present medications. I may have denied chest pain because I was having very little chest pain and nobody believed me about the palpitations, and I could prove the palpitations with a Holter. I can't prove a feeling. So I may have denied the chest pain, but there's no way I denied palpitations. That's the whole reason I was seeking help from everybody in the first place. That's the only reason I knew I was poisoned. Dr. S never advised me to continue with my present medications. He knew I was taking the blood pressure medication. I told him it was doing nothing to help me. In an August 10th report, doctor advised that he'd seen you 2 months earlier with respect to your heart palpitations, which you reported experiencing mainly at night. Doctor noted that you had hypertension for which you were taking medication. He advised you had no other significant medical history, specifying that you had no history of dyslipidemia, heart attack, stroke, peripheral vascular disease, or diabetes. He advised that you had an echocardiogram, which was normal, and that your clinical examination was unremarkable. He stated that your diagnosis was most likely isolated symptomatic PVCs and PACs. So this must be Dr. B. In October 15th chart note, Dr. S indicated that you had a history of hypertension and that you had recently been started on Celexa for your anxiety and palpitation. He noted that you had been seen by a cardiologist in the past and that you had a Holter assessment which showed few PVCs. He noted that you were very stressful and that you reportedly had more palpitations after exertion. He noted that your family members had similar issues and that they were on beta blockers. The assessment was of anxiety-related palpitation. Dr. S noted that you were started on a beta blocker for palpitation and high blood pressure. He also advised you to go for counseling. All right, this is the appointment where October 15th, Dr. S was the one who gave me the beta blocker. He didn't note that I was started on it, he gave it to me. This part where he says he advised me to go to counseling, maybe he said that, but I don't believe he did. I'm pretty sure that was a comment he made in September of 2019. In October 30th, chart note, Dr. S indicated that you reported a decrease in palpitation lately, noting that your blood pressure was still high, but that you had less anxiety lately. The assessment was of hypertension and palpitation. On the March 16th note, he noted that you were already taking metoprolol and recommended that you increase the dosage. Originally, I accused WCB of lying about this, but it turns out I was wrong. I just started a new job that involved 12-hour shifts, and the one pill in the morning was not enough to get me through the day. I needed a pill in the middle of the day. On March 19th, advised the term palpitations, noted that Dr. B's conclusion was a result of these tests was that you had an increased awareness of a few extra beats. All right, so the medical advisor for WCB goes on to state, Freon poisoning from an acute major inhalation can cause a variety of serious symptoms, although heart palpitations are not one of them. When I initially got this decision, I told WCB I wasn't going to fight it. I'm pretty tired at this point of reliving everything I've went through and dealing with all this. It's really hard on my nerves and I can't deal with it much more. It's why I'm going to do this video and then that's it. I'm done with this. When I wasn't happy with this decision, I decided to appeal, even though I told him I wasn't going to. And I was told by my caseworker I had a year to file an appeal. And then I soon discovered after that I only had 30 days from a written decision. And when I was upset about that and asked them what happened to the decision that they were supposed to mail me, they went ahead and said they forgot and went ahead and mailed out the decision. So I went ahead and appealed. It was very apparent from the first decision that someone was lying and I know it wasn't me. After filing the second appeal, they took 3 months to decide. Then WCB posted it to the online portal without notifying me, emailing me, calling me, or sending me any kind of letter. When I logged on a month after the decision and discovered that they did nothing to answer my questions or concerns, I was told that it was too late to file an appeal. While waiting for WCB to take their time with the second decision, I went ahead and filed a complaint against Dr. D because I suspected he was altering records. And this is where I actually received my medical files. The College of Physicians were the ones who sent me the evidence. I technically received the College of Physicians response after WCB's second decision, but to make the decision easier to understand, I think it's important to review Dr. D's letter for why he did not give me the beta blockers. This is my response to David's complaint. I am very shocked by this complaint as he's never made these complaints to me. This is stated by David in the complaint form, have the concerns been brought up to the doctor. I am also shocked by this complaint as the care I gave him is above reproach as all the records will show. Each of his complaints were dealt with quickly and thoroughly. I moved to that area and became his wife's doctor in 2010. I was not her doctor since childhood. David is confused about a lot of things. When she asked me if I could be his doctor, I also said yes. I first saw him as a patient on February 27th. He was having palpitations since age 16. He would have been 33 that day. He said it was worse with certain foods. It felt like his heart skipped a beat and he felt his heart rushing. He stated he had a family history of arrhythmia and that he was on medicine for blood pressure but did not remember the name. He said his blood pressure was up to 160/90, but on the medication it was now like 130/90, but he still had palpitations. On examination, his BP was 130/90, pulse 80, Normal head and neck, normal heart sounds, normal chest, clear and normal air entry, abdomen, obese, soft and normal bowel sounds. I noticed from reading my charts that he said he has had palpitations since age 16 and did not mention that day that he felt he was poisoned by Freon in the past. I had my office staff track down his recent blood work and chest x-ray. Once I had this, I sent this in a consult to cardiologist Dr. B, who is an excellent cardiologist and got so tired of his patients waiting 2 years for a cardiac echo that he bought the machine to do it himself in his office. In his consult, he did an EKG and a cardiac echogram, which were both normal. He noted that David has had palpitations for a number of years and thinks they had improved since he had left a previous job which involved Freon. His BP was even higher in Dr. B's office, and he started him on diltiazem for BP and palpitations. I next saw him on May 8th. I reviewed the cardiologist's letter with him. His BP was 160/90. David said he did not like the diltiazem and was having too many side effects. I thought a beta blocker might give him side effects like diltiazem, so I prescribed him Avapro. When I rechecked his BP on June 19th, it was 145/100. I increased his Avapro to 300 milligrams. Dr. S saw him next. It looks like he saw him for dizziness and lightheadedness and put him off work for 2 weeks. I next saw him on July 30th. He related to me that he had been arguing with his supervisor about shift changes. He had a form he needed filled out to return to work. He felt he was ready to return to work, and I filled out the form. He was disappointed he did not have a Holter report, so I consulted Dr. B again and asked if he could arrange this. He did. I next saw him on October 11th. His Holter report was normal, and I reassured him on that and explained the report to him. I convinced him that his palpitations and head rushes were anxiety attacks, and he agreed to try medication, citalopram, to treat it. He next saw Dr. S on October 15th. His BP was 160/100. He still had palpitations, so he started metoprolol 25 milligrams. His next visit again was with Dr. S on October 30th. His palpitations were decreased and his BP was 156/90. He increased his metoprolol to 50 milligrams. He next saw Dr. S on December 7th. His palpitations were better and his BP was 145/80. His next visit was with Dr. S on March 16, 2019. It looks like his palpitations were up and his metoprolol was increased to 75 milligrams. His complaint, Mr. David, was unsure if we had responded to WC, but this request was completed. The next visit and last one was February 26, 2020. His hearing test was normal and the referral had been sent. On that day, he stated the WCB had reopened his case from years ago when he says he was exposed to Freon and it gave him his arrhythmia. I don't remember him being upset or angry when he told me this, and he did not ask me to do anything at this time. In regards to Mr. David complaining about his episode, one can see that he is very dramatic in the presentation of his symptoms. Once he was fully investigated, he was unwilling to accept a medical opinion on his condition. That, of course, is his right. There are not a lot of things I can prove with this letter, like that I didn't run out of blood pressure medication, or that I claimed that I wasn't taking it, or how I didn't tell Dr. D that it was from a work injury. But the part where Dr. D claims that he did not give me beta blockers because I did not like the effects of diltiazem is a complete and utter fabrication. This is not a simple mistake of misremembering or misreading something. This is a complete fabrication. And apparently, if you're a doctor or WCB, it's okay to completely fabricate things. When the college physicians investigated this, got his evidence here, they told me that what he provided me was adequate health care. The blood pressure medication never worked. I never said that. Records show that during that visit, there was no mention of you being poisoned by Freon in the past. I can't control what the doctor decides to write down and what he doesn't. I told Dr. D that you do not like the side effects of diltiazem prescribed to you for you by Dr. B. Dr. D thought a beta blocker might give you similar side effects to the diltiazem. You've already seen the first cardiologist visit. He didn't give me anything. He said he definitely needs to be put on something like Tiazizac for his palpitations. And he says it again in the second cardio. I would suggest you try him on a beta blocker or a calcium channel blocker such as Cardizem. Right? Nobody ever prescribed this to me. They say, at the visit in February, when I was re-upping my beta blockers and getting my referral for my ear infections, you stated that the WCB had reopened your case from years ago when you said you were exposed to Freon, which gave you your arrhythmia. Dr. D does not recall you asking for anything to be done at this time. That's not true either. I told him to turn in all the paperwork to WCB, and the look he gave me was of total shock and bewilderment. And now I guess I know why. I looked at him and I told him, I don't care if you believe me, or all I'm asking you to do is turn in the evidence. And he couldn't even do that. He couldn't even do the one thing I asked him to do. You know, Dr. D reports he was shocked by your complaint. He believes you received attentive and respectful care from him. Dr. D also notes that no complaints were ever made to you, made by you to him personally. That's because Dr. D is still claiming there's nothing wrong. How do I tell somebody that they're wrong when they tell me that they're not wrong? All right, there's no evidence in support of your allegations of fabricated medical records. Yes, there is. He's telling me that I didn't like the effects of a medication that I was never given. That is a fabricated medical record. I don't know what these people here are smoking, but okay. So last thing I'll show is WCB's second decision. The worker, a central disposal technician, completed his own WCB injury report on April 10, 2019, and filed a claim for heart arrhythmia, which he relates to exposure to Freon 12 and Freon 134A, refrigerant, while draining fridges and freezers in the workplace on December 1st, as well as gas pulling on the floor from draining fridges, freezers over 5 to 6 month period. The worker claims the ventilation was poor and consisted only of a bay door, which he says was often kept closed during the winter months. There is a significant history of heart issues in the worker's immediate family. The case manager obtained medical documentation, but not the medical documentation from the walk-ins. She noted in her March 24th decision that the worker had been having heart palpitations since the age of 16 and been diagnosed with hypertension and anxiety. She secured an opinion from the board's medical advisor, who offered that the heart palpitations represent chronic increased awareness of isolated, harmless extra heartbeats associated with anxiety and hypertension, and that the worker's relatively minimal exposure to Freon would not prompt these chronic symptoms. He also noted a history of palpitations predating the employment since the age of 14. The case manager concluded in her decision that the worker's exposure to Freon in the workplace would not result in the diagnosed heart condition symptoms. Yeah, okay. All right, in order to prove the worker's claim for a compensable heart injury, I must be satisfied that the evidence supports that the worker's heart symptoms of 2017 arose out of and in the course of his employment. The mere fact that the worker worked in an environment that could cause respiratory heart effects under certain conditions is not sufficient to establish that those conditions were satisfied and resulted in a work-related heart injury. There must be proof of a significant exposure or contact in the workplace which would medically and reasonably account for the reported symptomology. The evidence does not support a cause and effect relationship between the worker's employment environment in early 2017 and the heart condition he was later diagnosed with. Scientific proof is not required in order to find causation. However, speculation that the worker's symptoms are the result of an employment does not satisfy the worker's burden of proof. Although it's the worker's position that he developed extra heartbeats, as well as hypertension, chest pain, anxiety, panic attacks, brain fog, eyesight dysfunction, and lightheadedness, as noted in his environmental exposure questionnaire, there lacks objective evidence of a heart injury condition that would reasonably result from the manner of exposure reported by the worker. The worker's history of heart events predate his employment. His note confirms how heart palpitations date back to the age of 16. A cardiology referral note, Dr. B advises of heart palpitations since the age of 14 and notes that they had recently become worse and that there's an immediate family history of heart palpitations and conditions. Dr. B report notes a several-year history of intermittent heart palpitations as well as severe crushing upper thoracic pain after becoming agitated with life events. Dr. B diagnosed isolated PVCs, and he recommended that the worker resume taking the hypertension medication he had stopped taking. Having symptoms related to a non-occupational condition prior to the start of the employment does not support the worker's symptoms or the result of the workplace. All right, Dr. S, on a July 11th note, confirms intermittent dizziness and lightheadedness, which the worker felt may be due to anxiety. Dr. S diagnosed hypertension and he advised the worker to take his blood pressure medication. On October 15th, he confirmed the hypertension history with medication for anxiety, and he noted the worker to be quite stressed. He diagnosed anxiety-related palpitations, prescribed a beta blocker, and recommended counseling. Dr. S repeated the hypertension and palpitation diagnosis on October 30th. He also recommended that the worker resume taking his hypertension medication. The worker's exposure to Freon was mild, as there lacks evidence of deeply breathing in close proximity concentrated Freon fumes. Regardless, the board medical advisor noted that severe Freon poisoning from acute major inhalation can cause problems, although heart palpitations are not one of them. All right, I'm just going to briefly go over this. The worker's relatively minimal exposure to Freon. How do you know that if you've never done an air test? If you've never bothered to do an air test, how do you know how much Freon I was actually being exposed to? And here they say the mere fact that the worker worked in an environment that could cause respiratory heart effects under certain conditions is not sufficient to establish that those conditions were satisfied and resulted in a work-related heart injury. There must be proof of significant exposure. You're telling me at one point that Freon can cause a regular heartbeat, and then you're telling me at this point that just because I worked with something that can cause a regular heartbeat doesn't mean that it gave me a regular heartbeat. Yeah, okay. You guys need to pick a excuse and stay with it instead of flip-flopping back and forth. Where I told the cardiologist I had severe crushing upper thoracic pain after becoming agitated with life events. I never told him that. I told him that I collapsed after I was ridiculed by my doctor for asking for an EKG, and then my wife, who had an accident, was enough to push me into some kind of episode. I don't know what. I never had a panic attack before or since. I don't know what it was. You know, he resumed taking the hypertension medication he'd stopped taking. I never stopped taking the blood pressure medication. I was taking it every day. I told them that if anything, it was making things worse. You know, having symptoms relating to a non-occupational condition prior to the start of the employment does not support that the worker's symptoms are a result of the workplace. All right, in Nova Scotia, you don't have to prove that your job gave you the injury. You just have to prove that it aggravated the injury. And I would say that regardless if I had an irregular heartbeat before I took the job, I would say that working in a known heart sensitizing chemical was definitely aggravating the heart condition. I mean, there's no doubt in my mind about that. You know, right here it says Dr. S felt, which a worker felt may be due to anxiety. I think I recall him asking me if I thought anxiety could be it, and I might have said maybe, but I feel pretty confident that I said it was definitely part of the problem, but it's not everything. I mean, I told him it was Freon. I told him it was the family condition when the Freon wasn't enough to get them to do anything for me, right? And this part where he advised the worker to take his blood pressure medication, that's a lie. And Dr. S, from what I can tell, has not altered any of his records. So I really would like to see what Dr. S has to say about all these appointments. You know, on October 15th, they originally told me that Dr. S had noted that I was on metoprolol, right? Now they're saying that he prescribed it to me, but he's also recommended counseling. Again, I don't know if he recommended counseling that visit or not, but I don't believe he did. And I believe he can clarify that if he types out his notes. And this part here recommends the worker resume taking his hypertension medication. I never told him I stopped taking it, so that's a lie too. And here again at the end they say, Freon poisoning from an acute major inhalation, which I suffered from a chronic inhalation, not acute poisoning, can cause problems, although heart palpitations are not one of them. I wanted to show my sleep study results. While not definitive evidence, I do find that it did support what I was claiming was happening. You know, a lot of this would happen while I was sleeping at night, and when I asked my doctor how it's anxiety if I'm waking up in the middle of the night covered in sweat and my heart is racing and pounding, and I swear he just shrugged his shoulders at me. At the time, the person who did the sleep study for me told me it looked like I was doing exercises in my sleep. I told them I think I was suffering from a regular heartbeat, and they told me, yeah, that makes sense, but legally we can't tell you anything for liability reasons. You will notice on my pulse rate that there is a constant build-up with peaks, often happening while I was sleeping, and it was bad enough to wake me up out of REM sleep a few times. This is those points where I was waking up, covered in sweat, confused as heck, I imagine. This is nothing like the hammock, which is what a normal sleep heart rate would look like, with the build-up and then a curve downwards and then going back up towards the end of the cycle. Mine clearly shows something was happening. Some of it may be tied into sleep apnea, but not all of it. All I know is I tried the machine for 1 month, and when it did nothing to help me, I didn't see any point in getting one at that time. Even though my wife's insurance covered a machine, we didn't have the money to pay for it up front. You can see where my heart would just keep racing in the middle of my sleep, like there was nothing I could do about that. You can see where I would wake up in the middle of my REM cycles. Right, and that's it for this segment.